This is Ralph Luis Abangan, and today I'll show you how to respond to 911 operator. Things you should do: stay calm, give your location or address, give clear answers, follow directions, remain on the phone until the operator tells you so. Hello? Is this 911? This is 911. How may I help you? Yeah, I think I just witnessed an accident involving two cars, and I think they are unconscious. Some of them have open fractures, and it's continuing bleeding. The victims are about 5 to 6 person. Okay, just don't touch them. You may worsen the fracture. Where is the location of the accident? Yes, in Barangay Alapan 1B, Road, Imus, Cavite, in front of elementary school. Okay, just don't leave them and wait for the rescue. Don't hang up until I say so. After that, the rest of the House of Samson will now apply first aid to open fracture, closed fracture, and burns.
Applying first aid to close fracture. Let the patient sit or lay down if possible. Remove jewelry, belts, and other restrictive items. Look for splint or bandage or alternatives like twigs, cardboard, towel, or clothes. Immobilize the injured area by applying splint and bandage to prevent further damage. Apply or improvise a sling for complete immobilization.
Ang tawag sa uri ng fracture na ito ay tinatawag na open fracture, kung saan mayroong broken bone sa isang parte ng katawan na malapit sa isang broken bone. So, bakit nga ba nagkakaroon ng open fracture? Kasi dahil sa posibleng pagkaroon ng broken bone sa loob ng isang parte ng katawan kung kahit nagkakaroon ng open fracture. Bakit mas mahirap gamutin ang open fracture? Sapagkat maaaring mapasukan ang open fracture ng mga bacteria o dirt na nanggaling sa... Dahil sa posibleng pagpasok ng dirt o bacteria, maaaring magkaroon ng infection ang open fracture. Tapos, the only thing na kailangan mong gawin is para mahilang open fracture is stop the bleeding, una sa lahat. Kasi baka maraming dugo ang mawala dahil nga open fracture. Pagkatapos ng stop bleeding, pagkatapos mong mawala ang dugo, kailangan mo siyang linisin sa tamang paraan. After mo siyang malinis, lalagyan mo na siya ng bandage, clean cloth, or kahit anong malinis na tela. After mong malinis, takpan mo na siya ng bandage, kahit anong malinis na cloth. After mo siyang takpan ng bandage, pwede na siya. Pero if may makaramdam ka na pain, kindly consult to a doctor or sabihin mo sa parents mo. Kindly consult it to a doctor kasi baka na-infection na yung sugat mo from the dirt na pumapasok sa open fracture mo sa mga surroundings mo. And that's it.
Applying first aid to close fracture in left leg.
Look for splint or bandages or alternatives like twigs, cardboard, towel, or clothes. Wiggle the toe of the patient if the patient still can feel the foot. Let the patient sit or lay down if possible. Immobilize the injured area by applying a splint and bandage to prevent further damage. Wait for the medical personnel or rush the patient straight to the hospital if medical care is needed.
A open fracture is one in which the bone breaks through the skin. When you are a bystander to this kind of accident and you are willing to help the injured victim, here is what you can do. Wear gloves or any thin plastic to protect your hands. Cover the wound with a clean cloth gently and don't put pressure on the fractured area. It is important to immobilize the fractured part. You may use a splint or any hard object that will keep the fractured part straight. Talk to the patient and let them feel comfortable. Remember, when you are a bystander, these are the essential things to help a victim that has fracture. 1. Call emergency medical services immediately. 2. Prevent severe blood loss coming from the wound. 3. Immobilization. It is necessary to immobilize the fractured part. 4. The patient conscious and calm until the rescue team arrives.
Treating major burns, third-degree burn. Call 911 and ask for instruction if you are not a trained first aider. Let the patient sit and lay down if possible and remove unnecessary jewelries. Use a clean cloth to cover the area. Raise the wound above heart level if possible. Watch for signs and symptoms include fainting, pale complexion, or breathing in a notably shallow. Wait or rush the patient straight to the hospital if medical team is delayed.
So I will be showing you how to apply a square knot. So a square knot is a type of knot that is used to bind things into place. It is used to bandage a wound. So to apply a square knot, you use a cloth or a triangular bandage. Then remember to that right over left. Right over left, then secure. Then after that, it is left over right. So left over right. Then, to untie a square knot, you pull the end to another end, then pull it. That's all. Thank you.
Mouth-to-mouth rescue breathing is effective in delivering oxygen into individuals' lungs. Now, let's review mouth-to-mouth rescue breathing for adults and children. First, open the airway by using head lift, chin lift maneuver. Next, pinch the nose shut to prevent air from escaping when delivering breaths. 3. Create a seal with your lips around the individual's mouth. Blow into the individual's mouth and watch the chest, and if the chest doesn't rise, you may need to rotate the head or unlock the airway. Give an additional breath. Make sure the breaths are duration of a full second. If the chest doesn't into two breaths, continue giving chest compression.
Always remember, after giving first aid to the patient, make sure that you hand over the patients to the hospital.